Hey, everybody, Dr. Ryan Molli here, and you are not going to want to miss this episode. This is one of my very best friends. Haven't had the opportunity to speak to him for quite some time, but you'll kind of see we kind of fall right back into our old selves and pick right back up where we left off. He's an amazing orthopedic surgeon. He's an amazing husband, amazing father to two beautiful children. He's very close with his in-laws, with his parents, and just has a different perspective on life than a lot of different people. He's a very spiritual man. Functional medicine, that's a big buzzword that we're hearing today in the world. And as an orthopedic surgeon, that's not something that you would generally link to an orthopedic surgeon. But this guy, he's a little different. So stay tuned. You're not going to want to miss it. It's a great episode. See you soon.
All nurses to the nurses station.
Lawless country people are real close family. Lately, some of my kinfolk don't get around too good, you see. When that doctor asked them, son, how'd you get in this condition? They says, hey, soft bones, I'm just carrying on an old family tradition. They wanna know, Doc, why do you think I got some pain in my joints from years of playing hard in this life that's too short? When that doctor asked me, son, how'd you get in this condition? I says, hey, soft bones, I'm just carrying on an old family tradition. Yeah, yeah, yeah. Tell me all about it, Doc.
Hey, everybody, Dr. Ryan Molli here. Welcome to Hey Sawbones, My Story, My Passion. I'm your host, orthopedic surgeon, carpenter, entrepreneur, business owner, but most importantly, loving husband and father of three young and very busy boys. And today's guest is one of my very, very good friends from years past, former partners, and just a great guy, orthopedic surgeon, but he thinks outside the box. And just really excited to get caught up with him today and share his story with you guys. So without further ado, Dr. Blake Miller.
Right.
Yeah, absolutely. So, Blake, it's been a while since we've chatted. We had a little bit of time to chat kind of offline, but um, I'm really looking forward to our conversation today and then hopefully continuing conversations offline. And like I mentioned earlier, getting you on our other Red Carpet podcast, which is
Yeah.
obviously geared a little bit more towards the healthcare community. But, as we start out, I always ask my guests, um, could you give us a 30,000-foot view of who Blake Miller is, kind of where you grew up, your family, your basics on your training, and then we'll dive down into the details with the questions.
Yeah, sure. So I grew up in Albany, Oregon, which is a small town. Went to Oregon State for undergrad, and then I traveled to Iowa to do my medical school. So I went to Des Moines University in Iowa, then Michigan. So we were obviously in the same residency program. You were 3 years ahead of me. Um, you're the reason that I've just fell in love with orthopedics. I mean, you were a great mentor to me. I loved the way that you explained things. So you really kind of got. I loved orthopedics to begin with, and then you really sparked my interest to continue really learning about orthopedics. Went out to New Jersey to do my trauma fellowship. Came back and I joined you as a partner back in 2014, back in Livonia, Michigan. I was traveling around to three different hospitals. You were trying to get your joint practice up and going. Then, a year in, I think we both kind of decided that that wasn't the practice that was going to spark our careers in the direction that we wanted them to go. And so you had a great opportunity to go back to Meadville. And then I went off to Grand Rapids, Michigan, worked at a level one trauma center there for 5 years. After being there for 5 years, there was kind of a change in the way that they ran things at the hospital, and then I saw my way out of there and joined another hospital about 3 miles down the road to develop their trauma program. Didn't really pan out the way that I thought it was. Things were changing there, but not a big deal. But we live in Grand Rapids. I have been married to my wife for 10 years now, and we have two kids. My son Sam, who's 7, and Anna, who's going to be 5 in about 11 days. So we love it here. My kids go to Grand Rapids Christian School. They love it. They do a lot of that outdoor education. Just Western Michigan has a lot to offer, and we love it here.
Hard to believe your kids are that old, and hard to
You
believe
know,
that you guys have been married 10 years because I remember your wedding well.
yeah,
And, time just flies. You see people, and I'm sure if you saw our boys, uh, you'd be shocked because, when we moved back to Pennsylvania, Luca was 6 months old at the
right,
most. So he's going to be
yeah.
9 in a couple weeks. So when's your daughter's birthday?
The 16th
Okay,
of
he's
May.
he's May 20th. So
Yeah, okay, nice. So it's always hard to keep up with because my son was born on 10/19 of 16, and she was 5/16 of 19.
ooh,
So I always have to think about yeah, I always have to think about when their birthdays are.
yeah, my mom
Yeah.
of all people, she's amazing with dates. She can remember. I mean, people that have passed away, their birthdays, and she has these weird ways of remembering them. Like, well, they lived on Route 77, and this is that, and so she links the number with the this, and somehow it all works out in her brain. So
Yeah, we used to have that in the day when I mean, when we didn't have a cell phone, we would remember every single person's phone number. I think back to Oregon, I knew every single one of my friends' phone numbers. If you ask me your phone number, your cell phone number, I have no clue anymore.
yeah, I
So we
know
don't have to
3. I
use
know
that.
Karen's, mine, and my mom's. And
And that's about it.
yeah, and not even
Yeah.
my mom's cell phone, just their house number, which is the same house number I had growing up.
Yeah. Yeah. It's crazy.
So, we talked a little bit about the format, kind of the Q&A back and forth. 3 business questions, 3 personal questions, and then we'll flip the tables. I'll ask the same thing to you. Um, I give all my guests one veto. So if I ask you a question you're not comfortable answering, you can veto it. But I will tell you that this is like episode 30 something, and not one person has vetoed a question yet. So don't be the first.
Okay. Well, I don't anticipate that I'll have to veto a question, but
You never know
um,
what's going to come out of my mouth.
well, that's true. So, one thing I want to commend you on is getting that whole health joint institute going because we had been talking about that 10 years ago. I mean, when I came out of fellowship, this has been something that has been always something in the making. I'm very happy to see that you got it up and going. So my question is, and it's a loaded question, is how did you get it started? What was when you went back to Meadville, you took over a practice, and how did you get this thing started?
Yeah, so I was 4.5 years into, out of fellowship when I moved back to Pennsylvania. And when I originally moved back, I had joined a multi specialty practice where there was a spine surgeon, a sports medicine orthopedic surgeon, and a foot and ankle orthopedic surgeon. And I was the joint orthopedic surgeon that replaced another very busy joint um, replacement orthopedic surgeon that was retiring. So for 2 years, I was under contract with them in their existing practice. Started to realize that, as you found too, it's just like, is it the right fit? Do the personalities mesh? And it was very obvious from day one that the location was the right location, the patient mix was the right patient mix, but the the relationships and the personalities and the partnership wasn't there. And that's not to blame or point fingers at any one person, but it just wasn't right. It wasn't the right fit. And, Jared and myself and you had been talking for quite some time about a way to be a little bit more impactful than, my day job of cutting people open and putting metal and plastic in them. So um, I reached out to Jared and I said, hey, I'd like to start my own practice. Looking for a name that kind of represents the mentality and the mantra of the practice. And I just keep going back to whole health, which was kind of that project that we were working on in Michigan, but it was whole health communities at that point, which was a massive, massive project, as you probably remember.
Yes.
And but the basic tenet of that was to try to look at the whole person, and almost like an osteopathic type of philosophy, but even beyond that, like their mental well-being, their physical well-being, their emotional well-being. And instead of just saying, yep, you need a hip or a knee, but you're obese, you're an uncontrolled diabetic, you smoke, maybe you have, some underlying mental health issues that are debilitating and would significant, significantly affect your outcome negatively. So I said, why not just tell them, instead of saying, hey, go fix this, come back when it's fixed, help them fix that and help them show them the path for that. Um, Lifestyle modification, medical optimization. And that's really where, like, Whole Health Orthopedic Institute, when I first started, it was actually Whole Health Joint Replacement Institute, because that's all that we did. It was just me. And then um, Dr. Frendak, who had retired for 2 years, decided to come back out of retirement, work part time. And to this day, he still works part time, and he's got a great gig. He's doing 300 joints a year, works a day and a half a week, does a half day of clinic and a full day of surgery a week. And he's an amazing guy to have around. He's 30 years of orthopedic experience, tried and true. He's from the community. He knows the community. He actually did the same fellowship as I did, obviously before me, because he's, I think, 62 or 63 now. And but he trained under Tom Mallory and Adolph Lombardi. So we had similar backgrounds, but it took a while to kind of get the concept of whole health going. It was more of a traditional orthopedic practice right out of the gates. But then we started expanding and started doing more than joint replacements. And then just a year ago, almost a year and probably 2 or 3 months ago, we were finally able to open the Wellness Institute, which was kind of one of my main goals from the get go. But it's like baby steps, right? And do what you do it really well before you try to go on and take on another project. So we're in the infancy of that, but our Wellness Institute sees every single one of our surgical patients before surgery, optimizes any risk factors that are able to be optimized, whether it's helping these patients lose weight, helping to get their diabetes under control, helping to increase their nutritional status, helping them to stop smoking, helping them to get the mental health and awareness aspects of their life under control, to then mitigate those risks, take them through the surgical process, and hopefully exit not only with a hip or knee that hurts less and does well, but with minimal complications. And hopefully they've learned those lifestyle modification tools and tips to improve their overall wellness and health moving forward. So it's been a big work in progress.
Sure. So if I'm a patient of yours, how is my experience different at Whole Health Orthopedic Institute versus coming into just a standard person in Erie, Pennsylvania that's going to go get a total joint there?
Yeah, I mean, I think it's different right from the get go. There's a great book that I've referred to on a couple podcasts. You may have read it. If not, I think you would really enjoy it. It's called Unreasonable Hospitality. You ever heard of it or
I've
read it?
not read it. No. Mm.
It's by Will Guidara. And Jay, if you could put that book right here. I read that probably 2 or 3 months ago, and um, it's always kind of been my thought process and my mentality, but he put it into words. And it's a totally different industry. He's a restaurant owner in New York City, and started a restaurant that was kind of mediocre at best, 3 stars. Actually, I think they were 2 stars when he first started, and took them to like the goal of 4 stars, and actually became the number one rated restaurant in the world within
Wow.
a just over 10-year span. And it's it's exactly what the title is, unreasonable hospitality. They were doing things that no one expected. Everybody just, they want to go to a nice restaurant. They want the food to taste good and they want the service to be like nice and reasonable, right? Well, he was unreasonable with it. So, for instance, people would walk in the door and the host or hostess would greet them by name. And these people were like, how do they know my name? Now, granted, they had reservations, but they would do the research. They would Google them and figure out and Google image them so that when they welcomed them there, they were being welcomed like in person by somebody that they'd never met before. Um, they would find things that were like just so important to them. Say it was like somebody's anniversary. They'd find out like where they got married and they'd almost recreate that special. For instance, one was they got married on a beach. They shut down this private room in the back, filled it with sand, played the wedding song from this couple's wedding. Now, obviously, I can't fill my waiting room with sand. I mean, these are truly unreasonable things that they're doing, but there are
Yeah.
lots of little things that you can do that most people would never expect a physician to do. So it's the little things. I call all my patients the night before surgery. Our pre-op education. You remember that about me. I was always big on that. I continue to do that. 14 years into my practice now, I do at least one, sometimes two educational seminars per month, and it's really grown. I mean, the one that we hold, our main one, is in our lobby. We get 75 to 80 people every single time. It's a full house. It's standing room only. Um, the I just started praying with all my patients before surgery. I offer it to them. I don't obviously force it upon
Yeah.
them.
Yeah.
It's just those little things like that that other people just aren't willing to do. They're not hard. Um, I started a concierge branch of my practice 3 years ago, which allows me to spend a lot more time with my concierge patients. And it's a lot of extra amenities for them. I give them my personal cell phone. I give them my personal email address. They literally have 24/7 direct access to me whenever they need me. So little things like that other people just aren't willing to do um, for whatever reason. I don't know why. Whether it's lack
Yeah.
of passion, maybe it's viewed by them as more of a 9 to 5 job. I think you and I both know, and you and I are similar that this is my career. This is my passion.
Yeah.
Yes, I do have my personal life, but this is what I truly believe God put me on earth to do, at least professionally. So I'm going to give it my all, everything I do.
Yeah. Yeah. So this will kind of transition us into the next three questions too, but it's kind of a business, family related question. So you're a phenomenal entrepreneur. I mean, you have done amazing. I love watching your stuff on LinkedIn, what you're doing. How do you find the balance between being an entrepreneur, a surgeon yourself, and then your wonderful family? That like what's a balance? What are the boundaries do you set, and how do you set those boundaries?
That's a great question, Blake. I will say that it's it's not something that came natural to me, and it's something that I had to learn over time. And it's something that I probably, not probably, I definitely wouldn't have been able to do on my own because for the first decade of my career, I struggled with that significantly. Work was very dominant. It wasn't that I didn't enjoy the time with my family, but it would bleed over, and um, there weren't those boundaries in place for that. So um, about 4 years ago, I started working with a life coach, and I speak with her almost on a weekly basis, usually at the very longest, maybe every 2 weeks. Um, and I was just very diligent with that. And she works on all those aspects, right? So she realizes that my heart, my soul are into being a healer, to being a physician, to giving my patients everything I have every day. But she also understands the balance of um, the family life and the burdens of both of those. And the burdens, I don't want to make it sound like it's a negative, but when you're doing the volume of surgery that I do, you're running a business, you're a practice owner, you're doing two podcasts. I mean, no one's forcing me to do this stuff, right? I'm choosing it. So I'm not asking for sympathy or anything like that, but it is, I do realize that when I have a lot to do, I'm better because I manage my time better when I don't have as many things going on. It allows me to get a little sloppier in my life, right? Like maybe I will be like, I'm going to watch this TV show and I'll work out later. And then later becomes tomorrow. Whereas if I'm busier, my time is more precious. So I have to be much more diligent about when I'm doing something, and it allows me to stay on task better. And then the family piece, I've just really focused on when I come home, other than like my concierge patients, and just that kind of stuff. Like my phone is kind of away. It's with me, but it's not a constant distraction. I got off of social media. The only thing that I do is LinkedIn, which is a kind of a professional Facebook, if you will, for our listeners that aren't familiar. And to me, I learn a lot from LinkedIn, right? And it's an ability to share cases and experiences and help influence others, as well as being influenced by others. And I read a lot of audiobooks. Um, I guess I listen to a lot of audiobooks,
Yeah. Okay.
or read books when I'm not in my car, because I do have about 2.5 hours or so in a car every day with my commute. So there's a lot of time there for reflection and education, and meditation's a big part of my life. Um, Exercise is a big part of my life, and I find that those times when there's a lot of quiet really allow me to ground myself. And then again, my life coach, I can't give her enough credit for really giving me tasks and saying, all right, between this time and next time next week when we talk, here's your homework assignment, or here's how you need to think about things. Because forever, Karen was always like, who do you talk to? And I was like, what do you mean, who do I talk to? I talk to myself. I talk to God. I pray. But
Yeah.
those are my thoughts. And when you get in your own head, you get stuck, and you can only see things through your lens and your perspective. When I started talking to Allison, my life coach, it allowed me to really take a step back and see how my actions, my decisions, my words were influencing others. And just by little tweaks here and there, empowering people was huge at my practice, because I used to do, it was just like, I have to do everything, right? I have to make every decision. And I have a leadership team now, and they've been in place for about a year and a half to almost 2 years, which has really, really helped uh, make my life much more manageable, because the day to day operational concerns that I had of running a business and a practice were a bit overwhelming. I mean, I have 35 employees, and to try to keep 35 people happy is virtually impossible. But when I have a
It is
team,
impossible.
yeah, when I have a team to kind of do that, and they meet every single week, and then they meet with the employees. Like when I first started, I had like this open door policy: come to me anytime you need me. And then I was like, this is not sustainable. So I very much have a closed door policy now. And there's
Yeah.
people in place that are like the buffers. And it doesn't mean that I'm not approachable. It's just not directly. You go to
Yeah.
there's a chain of command, and there's a chain of communication. And you don't need to be coming to me if your son has tonsillitis and you need to take a day off, right? Go to this person. That person can then go to this person. And I'm oftentimes the last to find out, but like the ship is not sinking.
Those things are important, but it's not. It should be in the forefront of your mind.
Right.
Somebody else should be able to take care of that for you.
And for a while they needed to be. It was a young practice. It was my baby. So I
Yeah.
felt like I really needed to keep my finger on the pulse. I still have my finger on the pulse, absolutely, but it's from a distance now.
Yeah. All right. So some of the more personal questions. Um, what is your most memorable moment with Karen?
I would say the times when it was just her and I, which with three busy boys is very challenging and difficult. And I can't think if I can. I can't say one moment, but all of the classical moments were just her and I. It would be our honeymoon when we were on a cruise ship for 10 days. And yes, there was other people, but no one we knew. Yeah, we met friends, but it was her and I. So I had her undivided attention, which is very, very difficult, especially with a family. And she had
Yeah.
my undivided attention, which is equally as difficult with a busy
Yeah.
family and a busy work life. Um, our 10-year anniversary, we went to Greece. Probably one of, if I had to say there was like one time, that was probably the best trip I ever had with her
Yeah.
because it was just her, it was just I, and we were in an amazing place. Um, just beautiful scenery, amazing food. It just seemed very fairy tale ish, but like memories that I'll cherish for the rest of my life. 15-year wedding anniversary, we went to Hawaii. We never left the resort. It was a very lazy vacation, but it was exactly what both of us needed
Yeah.
because we were both a little burned out at that point.
Yeah. Yeah. It's easy to do these days,
Yeah.
especially with life as it is. Um, I know that you take your kids on a trip every year. Is that correct?
Yeah.
So,
Individually, each of them get.
yeah. So, with each of your children, what is the best trip that you took with each of them?
Oh gosh, I think, and this is going to sound a little cliche, but it's like whatever the current trip is, and we just make the most of it. Like this year, Santino and I. This is a classic example of just like when life hands you lemons, make lemonade. Um, Obviously, he's a huge basketball guy. His favorite player is Steph Curry. We've tried 3 different times to see Steph Curry play. First time we bought tickets. They were actually playing in Detroit, and COVID hit. Game canceled. So it was like heartbreak number one. Heartbreak number two was um, just this past fall. They were playing in Cleveland. Jared was able to get us like floor side tickets, but we were out of town with actually Stacy and Pete for their for Pete's 50th birthday. Just and there was one other couple, so there were 6 of us. We weren't going to miss that, right? So
Yeah.
heartbreak number two, and then I was like, all right, we are going because I don't know how much longer he's going to play. So I bought tickets to a Warriors game in San Francisco this year, and their assistant coach died, and they
Yeah.
canceled the game, and it was just like, oh my gosh. And I had bought these tickets 3 or 4 months in advance. I had the hotel, I had restaurants picked out, and I was like, well, we're still going. And
Yeah.
Anthony actually was like, before the game got canceled, he goes, Dad, I think the 49ers are playing that weekend too. They're hosting the Green Bay Packers for a playoff game. He's like, you
Yeah.
should go to that. I'm like, I'm not going to, like, that's a little excessive. And, but he planted the seed so that when I heard that the Warriors game got canceled, I immediately got on and I was like, I don't know if I'm going to be able to get tickets, but I was able to find tickets. They weren't great tickets, but they were tickets. And it rained both of the days we were in San Francisco, but we had a blast.
That's
And
awesome.
Anthony, this last year we went to Chicago, caught a Bulls game. This year we went to Boston, caught a Celtics game. Luca and I last year we stayed local, but we went to Pittsburgh, saw a Pirates game, um, and then this year him and I went to New York City and went to a Knicks game. So
That's awesome.
they all like culture. They like cities, and not necessarily like to live in one, but
Yeah.
like my favorite thing that I did with Luca in New York City was literally we played catch for about an hour and a half to 2 hours in Central Park. We played football, and it was awesome. It was better than the Knicks
Yeah.
game. It was better than the restaurants we ate at. It was just him and I. It was sunny. It was beautiful, and memories forever.
Yeah. Those are the things that I like the most with my kids too. It's nothing specific. It's just going out and playing catch
Yeah.
or just being with them is amazing. So here's another deep one. So as we started the podcast, you talked about you pray with your patients. How do you feel your spirituality impacts your practice, how your patients perceive your practice, and ultimately how you run your practice?
Yeah, so I can't answer part of that because it's so new, like my openness about it to them. Um, I have had a handful, and I mean in 14 going on 15 years of practice, I would say maybe 5 or 6 patients that have ever asked me to pray with them before surgery, and I was always like, yeah, absolutely. And we'd say a prayer, and it was powerful. Um, and then the one time that I caught myself actually praying during surgery was a very, very challenging case. I was fearful. It was a total knee, and this gentleman was late 80s, had extremely calcified popliteal vessels, and at the time, I didn't know exactly what had happened, other than I had a bleeder in the back of the knee. I could tell it was venous because it was dark. Obviously, I had a tourniquet up, but it was not stopping. And I never opened an Aquamanus. And for those of you out there, it's a 2 prong device that kind of helps to seal tissues or bleeding. And I opened that up, and it was just like trying to put gum on a dam that's leaking, and it wasn't working. And so I packed the back of the knee. I'm doing all the things that I know to do, and I just said, you know what? I just need to take a moment and just pray. And as I was waiting for some of the stuff that they were bringing in the room, and the knee was packed, um, I did the only thing that I knew I could do, which was pray, and just to ask, God to get me through this case, to get this patient through this case, to allow this patient to survive, allow this patient's limb to survive. This is not easy talking about, especially on
Yeah.
camera, because as surgeons we're supposed to be perfect and this or that, and there wasn't there wasn't a technical error. It wasn't like I the vessel was cut. What ended up happening, I had to end up life flighting him to a higher acuity facility. He had such calcifications that one of the veins, one of the branches off the vein, plucked off because his vessels were so rigid. And fortunately, by the end of the case, I did get it to stop bleeding, but I had to send him for vascular studies. He did fine. There was no surgical intervention needed. They did vascular studies, and that's what was determined. So I was just like, thank God. But I truly believe that my my faith and me reaching out to God in that moment helped to get me through that. It was one of the hardest nights in my life professionally. I came home, I cried to my wife, I cried to my boys. They didn't know what was going on. I didn't go into details with
Yeah.
them. They didn't need to know that, but they
Yeah.
just knew that I was
Yeah.
hurting and that it
Yeah.
was something work related. So, um, I'll let you know the last part, which is like, how does it impact my patients? Because I literally just rolled that out this week with the prayer piece. I had 16 cases this week, and 11 of the 16 people um, consented to praying with me, and 5 did not. Of the ones that didn't, 4 of the 5 were male. Only
Yeah.
one male prayed, and the one female that didn't pray, she was a Jehovah's Witness. So I mean,
Okay.
take from that whatever you
Yeah.
want to, but um,
Yeah.
and 2 or 3 of the ones that did pray um, broke down into tears as we prayed. So it's obviously going to be an impactful piece to my practice. And if obviously this goes back to like Dr. Kelly, and Dr. Kelly very well. I remember asking him one time as a resident, like, hey, this is in the back of my mind. Like, you hear all the time about physicians getting sued and this and that. And how do you deal with that mentally, and how do you avoid that if possible? And he goes, well, you're not going to entirely avoid it, right? Like, I think the statistics are like you can at least expect to get sued at least one time in your career. And I've heard stuff as often as every 1 in every 10 years of your career. And I'm sure for some physicians it's more frequent, and maybe for others it's less. But the one piece of advice he said to me was, he's like, Ryan, the only thing I can tell you that's worked for me is if you genuinely care about your patients and they know that you genuinely care about them, that's probably the one singular thing that you can do to try to avoid lawsuits or this or that. Um, and there's people like I definitely have patients that don't like me, that think that maybe I'm arrogant or this or that, and as we all probably have, and it's
Yeah,
just like
for sure.
they don't see the vulnerability, they don't see the sleepless nights, they don't see the tears, they don't see the the efforts getting put in behind the scenes every day, the planning. They think that I just show up, do my thing. I'm a robot. I don't have feelings, and I don't care what the outcome is. It's like that couldn't be further from the truth. So I do think that
Yeah.
this will help um, my patients to just connect with me better.
Yeah. And then, you look at what you've built and it's like this stuff didn't just show up and then you just showed up to work. Like there was a lot of effort that was put into this and it was every single brick in that building was thoroughly thought out by you. And that's what they don't see. And I used to talk to my one of my practice partners about this at Spectrum. It's like he wanted to develop he was a tumor surgeon. He wanted to develop a tumor program just like they did at the Mayo Clinic where he trained. And I kept on telling him, I said, you didn't, you want the result. You don't want you just want the result of everything. You don't you didn't see the process. The process was the challenging part.
Yeah.
You just want the result of that process without going through the process. And that's not a reasonable thing to even consider.
Yeah. No. And I think that a lot of people and physicians, you know, people have this misperception that physicians just make too much money or this or that, or that people are focused on money. I never once have ever focused on like how much money I make, right? That is the result, but that's not where my focus is. My focus
Right.
is in the development and the process. And although it's been painstaking, that process of starting my own practice and uh, staffing it and all the challenges that go along with it, I would not change it for the world. And if you do things the right way and don't focus on the end result, those things will just work themselves out, right? Like if you just take
Yeah.
really good care of people, give it everything you have, like good things come to good people when there's good intentions.
Yeah, I agree. And I think that, when we talked about this when we started the concept of whole health communities, is our goal was to take care of patients. And if we took good care of patients, the money would be the result of that. But that couldn't be our goal. Like
Yeah.
our bottom line was not the goal.
Yeah. It was essentially the reward at the end of
Mhm.
it's just like a farmer. Like a farmer, yeah, they want to yield a good crop, but like they aren't thinking about how much corn they're going to get off this crop, or how much wheat they're going to get off this crop, or soybeans they're going to get off this crop. They're focused on the process of tilling the ground, planting the seeds, the weather, the this, the that, the all that goes into nurturing that, and fertilizing that soil seasons before. And what comes out of it is what they put into it, right?
Right.
And I've never actually thought about that analogy until I just said it there, but like it's very much the same. You get out of it what you put into it, and
Yeah.
you gotta maintain, you gotta fertilize, and you gotta put a lot of time and effort and love into it if you want it to be successful, and not even just successful, but sustainable, right?
Yeah.
Because
And
you can have something
never, and
successful, but if it's
yeah.
not sustainable, what's the point?
And you never want to be complacent. We're like, okay, now I've got the process in place. Now I can step back. That's not how this works. You put a team in place to now cultivate it for you. But the thing is like you can never back off from that. Now you have to nurture it continuously.
Yeah, farmers
And
rotate crops, right? They don't just plant the same thing every year because that is going to deplete that soil from that particular nutrient. So you
yeah,
gotta change it up.
yeah, yeah. And then, you have to stay on top. Like then new technology comes along, and how am I going to implement this, or is this going to be useful for what I do? And those are the things that now you can focus on as essentially the CEO, is your outward thinking and saying, okay, what else do I need to implement in this to improve this process?
Absolutely. Blake, I always love talking to you because our brains are very much wired the same way. And
Mhm.
I miss, being able to be near you and have these kind of deeper conversations because there's very few people that I've ever met. I could think of three. Jared, my good buddy Travis, who you'll meet at some point, especially when we do the Red Carpet podcast, because he's my one of my best friends and co-hosts on that, and yourself, like where you can get deep pretty quickly with somebody, and to me, that's the fun stuff in life.
I got chills when you said that because I feel the same way. It is very comforting to know that you have somebody that you can talk to in such a deep level, and they just kind of understand what you're saying,
Yeah. So shall we turn the tables here?
if you'd like.
So first business question. All right. Yourself, like myself, and like a lot of orthopedic surgeons, you have, I don't want to say bounced around because that has a negative connotation because we've all done it.
Mhm.
But you are finding your way in your career. And
Yes.
very, very rarely do people, when they take a job in medicine, or I'm just going to use orthopedics, is that their final destination. And, when you first came out, I think that you, just like I, had this perception of this is what I'm going to do, this is where I'm going to do it, and this is where I'm going to do it
Mhm.
forever.
Mhm.
W- What was it, or who was it, if there was a person that helped kind of let you know that it's okay to um, move and relocate and start over and continue to search for what really gives Blake Miller a sense of purpose and satisfaction with your career?
I think that there are a couple of people in your life that you can say that are truly influential. And you are one of them. A good friend of mine, Joel Post, who I went to medical school with, he was a tumor surgeon we were talking about earlier. He was kind of recruiting me over from Detroit. And this was a position that I felt, and this goes into kind of a spiritual situation as well. So my wife was very opposed to leaving the east side of the state, but she kind of saw the writing on the wall. She's been extremely supportive throughout my entire life. And so when she saw that I was busy in Detroit, but I was busy driving. I wasn't busy with a practice that was sustainable. I was driving to three different hospitals looking specifically for trauma. I wasn't at a place long enough to get block time or anything. And anyone that understands how hospitals work is that there's surgeons are competing for time in OR. There are only so many resources that they have, and so it's really hard. So there's something called block time where you have dedicated time in this room. Well, trauma is very difficult to get block time if you have a not a busy hospital and they don't have a lot of trauma coming in. And so I was kind of driving around to these hospitals, and I was like, Amanda, Amanda's my wife, is I can't do this for long term. We were struggling with infertility at the time, and so I said, let's just can we consider going over to the west side of the state? I'll be at one location. It's a high volume, high acuity trauma. It's exactly what I wanted to do. And when I went over there, I interviewed, and it was with five. I was going to be one of five orthopedic trauma surgeons. When I went on vacation, I would be truly on a vacation. And she kind of saw that this would be a good thing for me. And so she said, okay, let's do it. And she kind of begrudgingly did it. She's very happy here now. Um, it was a, it was a, it was my dream practice. It was literally what I wanted to do. It was like 5 to 6 trauma cases a day. I was working from 6:30 in the morning to fracture conference until about 10 o'clock at night. We struggled with infertility. We finally had our first child, Sam, who's 7, in 2016, about a year after I'd started. And Sam is a good buddy of mine. I mean, we talked about how being with family is the most important thing. But I was literally working from 6:30 in the morning to 10 o'clock at night every single day, except for my office day, which I would do was an early day for me, which would be 6 o'clock, and your kids go to bed at 7:30. So I never saw my kids, and my daughter was born, and my daughter is a quality time person. So anyone that knows, the love language is my daughter is quality time. My daughter hated me when I was working. She never saw me. She wanted nothing to do with me. And that was kind of the writing on the wall for me was like, what's truly important in my life? I don't do I want to do I want to be selfish and do this job that is literally going to take years off of my life? I really enjoy it, but it's going to drive me into an early death. And then, I think God intervenes in very interesting ways, and He allowed me to obtain this job that I thought I wanted, and then I realized that I didn't like it. Then COVID came around, and we were offered a contract by that hospital, and there was no value like they said we can pay you as little as we want and we can work you as much as we want. That was essentially the contract.
Sounds like a pretty good
And I
deal.
said, I'm not agreeing to this. And so it forced me to leave, and which I'm thankful for because I started working 3 miles down the road at a smaller hospital, level two trauma center. And they wanted myself and my partner at this other hospital to develop it. But they never nourished it. They never kind of let us be involved. They once they hired, it was kind of evident to us that they wanted us to be their workers and not they didn't want us involved in the planning. And so I fell into this general orthopedic role that I just absolutely despised. I did not like doing it at all, but it gave me time with my family. So that was the trade-off. And that was so now I have a ton of time for my family, which has been a huge blessing. Well, fast forward to 3 years later, and they're not renewing our contract, so I'm going to be out of a job in September, and now I have to look for something else.
You're saying
So
this
I'm
upcoming
gonna
September?
yeah, yeah, yeah. So they did not renew our contract, and so now I'm going to be looking for something else. Well, I found something else. I'm going to be working in Carbondale, Illinois, for 10 days a month, away from my family. Again, not an ideal situation, but I get 20 days off a month. And my path. I've started a business and want to develop that, and think that there's a better way to deliver medicine. And so I think that the thing was is I don't know that I've ever come to this point of like when it was okay. It was like I just kind of viewed my life as what do I want out of my life, and what do I want to concede, and what are my priorities? My priorities are my family, and what can I do to position my family in a way to be financially secure and invest my attention into them because that's ultimately what matters in my life. And if you have if you have a moral compass, if you know what your priorities are and you are unwavering in those priorities, then you'll find the rest of the stuff to me is just noise, and you figure out that noise as it comes.
That's beautiful. Like, um,
Thank you.
I didn't know about your most recent, um, you know, job
Yeah. Yeah.
situation, but um, I love the fact that your guiding principles and your you used the word moral compass are really what's helping you make these decisions. And I give you a lot of credit for that because there's a lot of men and women out there, and I'm not just talking medicine or orthopedics, that stay in a job because it provides food to put on the table and this and that. But what's the point of putting food on the table if you're not at that table eating the food with your family,
Yeah.
right? So
Yeah.
kudos to you for recognizing that. Kudos to you for not accepting something that isn't exactly what you want it to be. And I don't know, and I'm sure you don't know if this kind of locums position that you're going to be taking up is your final destination. I have a feeling it's not,
Yeah.
but um, I'm here if you ever want to talk about any of that kind of stuff. And um, I just
Yeah.
love the fact that your family is your focus.
Yeah, thank you. I think it's easier for it not to be as a surgeon. Going back to the the story that you had about that patient that had the vascular injury. There's nothing more as being there. I mean, I've been there. There's there's nothing more that you are powerless and you feel so vulnerable in those situations. You're like, what the heck did I do? Because knowing you, this is not a job for you. This is a true passion. You
Yeah.
care deeply, deeply for your patients, and I do as well. When something bad happens to somebody, this is not something that goes away. I remember going on a trip with you to Pennsylvania for our hunting trip. Right before that, this was my first year in my practice, so we were going out, and do you remember that trip?
Yeah. You were in the woods for like 2 hours. You're like, yeah, I'm done.
Yeah, that's how I feel about hunting.
You, you and
So
Travis,
anyway,
you and Travis need to meet because he had never gone hunting. He shows up like Elmer Fudd, goes out, has a beautiful 8 point, 10 feet from him, goes to shoot, click, doesn't go off.
I love the guy.
The deer doesn't even leave. It's like, oh, this guy's not a threat. Tries to reload, goes to shoot again, click. And then there was another, like an hour later, he's so just like done with it. And like another buck walks right by him. He never even saw it. Um, it-
Yeah.
so continue with your
Oh,
story though.
yeah. So I remember that night. So we were in Pennsylvania, I think, for a couple days, and we went hunting. And right before that trip, I had done there's a kid in a 24-year-old kid that was in a rollover car accident, broke his scapula. And I had never done a scapula on my own at that point. And so I did this case, and I saw him 2 weeks later, and this was right before our trip. Saw him 2 weeks later, and he was unable to like externally rotate his arm, and it was right by the nerve that supplied innervation to the infraspinatus. And so I was I never saw the nerve in the case, and I thought that I had transected the nerve, and he was never going to get that function back. And this was I never thought that, oh, I peeled it off of the origin, so maybe that's the problem. I just went right to the like I cut the nerve. And I remember waking up at night in bed in a panic attack of like, I just messed up this 24-year-old kid's life. And I remember it distinctly. I'm like, this is a horrible thing to ever feel. And then I saw him in the clinic after we get returned. I saw him in the clinic a couple weeks later. He's like, oh yeah, no, I'm good. I can actually rotate it. And you go through this unnecessary anxiety about these things because you just don't know. And it it is if you care deeply about your patients, people know what I'm talking about. Like
Yeah.
this is true. It really impacts you mentally about did I screw this person up for the rest of their life? And that's really hard to it's a hard pill to swallow.
Yeah. Lots of sleepless nights for sure. So I'm going to ask you another business question that's kind of related to what you did your fellowship in trauma. Um, I love the story that you shared about the gentleman with the scapular fracture. But was there ever a moment where you had a patient come in and God bless you for what you chose to specialize in? Because I remember I liked doing trauma, but I didn't like the polytrauma. It was very intimidating to me. And I'm like, I'm not a lazy guy. I'm a hardworking guy. But I like to know my day, right? Like if I'm going to do 6 or 7 cases, like this is my day. I can plan it. I know how long it's going to take me roughly. But for you, you didn't know what's coming in, that unknown. Did that ever get to you mentally where that would produce the anxiety in me? Like I would lose sleep and my pager wouldn't go off just because I had like phantom pager syndrome.
Yeah.
And I remember like having these conversations with you as you were doing your fellowship and coming out, where I was just like, God, like it takes a special person to want to do trauma. Do you still have that thing in you that enjoys that, or has that changed over time?
Some of it has remained the same, some of it has changed. So trauma is a systems based care model. It is not something that you can do individually. And so you have to have a team, just like running a business. You have to have a competent team to do trauma. You have to be able to rely on your surgical traumatologists. You have to rely on your partners. I think that that's why these trauma systems are popping up, and that's why they're so successful. Is that everything that comes in, I'm gonna do 5 cases, and that's what my capacity is for that day. And whatever I don't get done, I can pass off to a partner. So I think it's the individual trauma surgeon is not even a value. It's not even a viable structure anymore. It's not safe for patients. It's not safe for a hospital system. And so the at the level and trauma center that we had a great relationship with our trauma surgery team, the surgical intensivists. We had I mean, I had 4 other partners that could do exactly what I did. You share, you share you share care with people. And the thing that I love about trauma is everyone's different, and you have to think through their physiology. And you have to think, okay, if I do do I need to do damage control orthopedics? Do I need to do, early total care? Do I need to do somewhere in between? Like, do I need to do something that I can stabilize some things, you know, uh, definitively, some things I need to temporize. Those things are really, I have to think through those things. And then, but for you, a total knee takes you X amount of time. A total hip takes you X amount of time, and you have those and whatever. My biggest downfall is the turnover. I know like a tibial shaft fracture, no matter how comminuted it is, because you can do different techniques. It's either going to take me between 30 minutes to an hour, just because you get so used to doing them that you're just like, this is the process. And so my day is no different than yours. I know when I should get home based on the cases that I have. That's going to change from a day to day. And if I have a difficult acetabulum, that's going to take me 2 hours, 3 hours. Then that's just the way it is. But those don't happen often, and that's okay. But I think from a perspective of the single trauma surgeon, the system that you are familiar with, that is not, you're doing trauma as a total joint surgeon. That's not the trauma system that I'm used to, and it's not a sustainable model. I think the models they've come up with now are much more sustainable and much better for a work life balance.
Yeah, I just think about the other things though that like there's predictability with what I do, not only in the case mix but like complications, whereas yours is like a little bit out there, right? Because you've got all these other variables, whether they're open fractures, whether there's compartment syndrome, and for people out there that don't know what that is, if there's Blake, you can probably explain it a little bit better than I can. But these complications that can be absolutely devastating to people, where they can lose their limbs on a like that's what I'm kind of saying, like that
Yeah.
that just brings like that anxiety to me that I don't have in my day job that you kind of do have.
Well, I think it's all about managing expectations, right? So I think for me, doing a total knee or a total hip is much more stressful for me than it is doing a trauma case. And you get used to having these conversations with people, but when you're having a total hip or a total knee, and one is a lot of people have them, and so they talk to people, and they have these levels of expectations that are sometimes unreasonable. And so I think for me, like the person that's coming in and has this very high level of expectation, like I'm going to have a normal knee, and that's just the way it's going to be. There's so much variability in total knee replacements, and even looking at some of the literature, it's like 20% of people don't like them, or they get stiff or whatever. Like that to me is stressful, because there's this high level of expectation, like I'm going to have this result. When you're talking to a trauma patient, not many trauma patients have other polytrauma patients that they can talk to. And so they don't know what to expect. And so when I have these conversations, I'm like, there are wild cards that are affected by this. And one is that you just have to, you level set their expectations, and you say, okay, this is going to be a process. This is not something that you're going to all of a sudden get up and start walking again, and everything's going to be fine. Like these are the things that you're going to deal with. Like if somebody comes in with a pilon fracture, which is high energy ankle injury, a lot of people will say that, well, this is, my friend had an ankle fracture and they did fine. And I said, you're comparing apples to oranges. Like this is not the same thing. And I think it's just level setting and just saying like, we're talking about a rotational ankle injury that they fell off, a step versus a car accident where you had an axial load injury, which is a devastating injury to your ankle. We're talking about two different things. And once you can get them to understand that, then they get it. And I don't think that they have that. They have a level of expectation, but I don't think they have like a very high level of expectation that they do with total joint replacement.
Yeah, I
And
guess
then they don't have anyone else that they can talk to about it because so few people have peel-on fractures.
right. And you always have that wild card that you can fall back on and be like, and I'm not saying that you, but like I'm just trying to save your limb here.
Yeah, I do my best,
Right.
and I will spend hours trying to do my best. But do I know that there is a limit to what our ability is to restore normal and good function of somebody with a talus fracture, calcaneus fracture, or a PLM fracture? Well, absolutely. And so for me, I have that conversation. Right? I'll fix them, but I will tell them straight down. I'm like, this is not a good injury, and this is something that is going to be lifelong. Like you are going to have to most likely have to have more surgery on this in the future, and it could end up in an amputation. It could end up in an ankle like an ankle fusion. It could end up in a very bad, in a just to manage your pain. This could be what we're dealing with.
Yeah.
And so I think setting those expectations early gets them, and they don't accept it right away. But I can tell you from I do a lot of amputations compared to a lot of other surgeons, right? So I don't do a lot of amputations, but I do compared to a lot of other people. And I can tell you that the people that come in with old trauma and peel-on fractures or talus fractures, anything around the ankle that is so debilitating to them, they come to me asking for an amputation after we've had several conversations about it. And then after they have it, they're like, I should have done this a long time ago. That was their answer because they realized how much life they had didn't have because they weren't able to function. And I think that the prosthetics for lower extremities are so amazing today that they didn't have before. And so I think that they don't, and again, most people don't know amputees. And so we have them talk to amputees and we talk to them about here are the limitations. Here's what you can do. And I think that people have these non-functional limbs that are painful, but they still think that that limb is better than in prosthesis. And sometimes it's not,
Right.
at least for them.
So Jay, this is where I'm going to need your editing expertise. So it's essentially, to sum it all up, it's hard to make chicken soup out of chicken shit, right? So Jay,
Yes.
you can put a nice
Yeah.
little bleep in there for that expletive. But
Yeah.
so my last business question for you, and this is like kind of, I would say maybe over the past couple of years, you've transitioned a little bit, or maybe have a little bit of a side gig with this quote unquote functional medicine piece
Yeah.
that you went and sought some additional training. I followed you. I can tell you, Karen is a huge fan of yours. She forwards me your newsletters all the time that you put out there. You've always been a really, really good writer and really, really good at explaining what to a lot of people would be complex. Can you just explain to our listeners what functional medicine is and what inspired you to kind of add that to your repertoire of when you're treating patients?
Yeah. So functional medicine is really what they term root cause medicine. It is a type of medicine that looks at the actual cause of things rather than treatment of symptoms. Um, I can tell you that the pandemic put me in a situation where I actually had to think about what was going on. Um, I was really kind of disheartened by the fact that there was this idea that they put out a solution to a problem in 6 months for a problem that we've never seen before. And then they would say, well, this is the miracles of science. And this is how advanced we've become, is that we can now develop a treatment without side effects to this thing that we've never seen before. But then I started to think, well, what about obesity and heart disease and MS and dementia and you name it, any chronic disease cancer that we've been studying for 80 years and come up with ultimately nothing. So it made me step back and say, well, maybe there's something else that's missing. And so I was just sitting at my counter, and COVID was a very difficult time for everyone. It was probably the darkest time in my life, because I was sitting back and saying, I don't know that I can honestly tell my patients that this thing that they've come out with is safe and effective. It might be, and that might be how the science plays out, but we've never used the technology before. Um, the animal studies were not convincing, and so
And you're
I
talking
was
about the vaccination.
yeah.
Yeah.
Yeah, and I'm agnostic to whether anyone got it. I don't care. I mean, I think that people have they should have their own decision-making skills to say, "Yes, I need this," or "No, I do not." So I don't have a strong stance on what people decided to do. But I did have a problem with how it was rolled out, and it was really kind of interesting to me that you have this thing that if saving a life is that's marketing enough. If it truly saves your life, that's all the marketing you need. But then we were bribed to take it. Then we were threatened to take it. And so I started thinking like, what is going on? Like this is weird. And we've never used this before. So yeah, it could be safe and effective, but I mean it takes years to figure this out. I mean, you look at the studies that come out on the pharmaceuticals, like 33% of drugs that are put onto the market come off the market because they're found to be not safe in post-market analysis. And the average time span for them, those drugs to come off is 4.5 years. And that was a study that was put out by Yale. And so I was like, well, how can I honestly tell somebody that this is safe and effective when the data was all garbage? I mean, they would put these people that came in with motorcycle accidents that had a death. Well, that was a COVID death because they tested positive for COVID, and the hospital would get paid for that. So I was very, very just disheartened by what what I consider to be a noble profession, what it was becoming. So it was a very dark time for me, and I was just sitting at my counter, and I was like, I was thinking to myself like, what did I do? And I wasn't a highly spiritual person at the time. I was a believer, but I didn't attend church regularly. I wouldn't say I was super spiritual. But I went through this radical mentoring program during that same year through the church that I would go to, and I've gone much more. Um, I was sitting there and I just heard this voice that says, get a functional medicine certification. And I was like, okay, I don't, I mean, the only thing I can, that was the Holy Spirit that was talking to me and saying, do this. And I don't even know why it said that. It just said, do this. And I said, okay. And so I did. And I remember that. So I was going through this radical mentoring thing through the church, which was every month we'd have to read a novel. It was a huge time commitment. And then the functional medicine studying was a huge time commitment. But I think those things had to happen together because I had this big spiritual awakening as I was getting my functional medicine certification. And I realized that God is insanely amazing at how he constructed our bodies and the adaptive mechanisms that he has for cellular functioning. So then I got baptized at the end of both of my functional medicine training and this radical mentoring group. And then I became highly spiritual. And then I started to look at the cell as the building block of life and really understanding how metabolism works and realizing that, well, maybe we're thinking about diabetes wrong, and maybe we're thinking about all these things wrong. I don't think the science is wrong. I think the interpretation could be potentially wrong. And the only way that we're going to be able to advance to what we're doing is to think outside of the box. And we have everything's pushed by evidence-based medicine, and I think evidence-based medicine is important. But that assumes just a different level of control in my book, because it says that we've reached the epitome of everything, and you need to practice this way. And this is the structure that we have in place, and this is the evidence that promotes that. But no evidence is 100%. So we're not reaching the pinnacle. And so one of my favorite people that I follow is Chris Masterjohn. He's a PhD in nutritional sciences. He said he thinks evidence-based medicine is important, but he said, I'm not evidence-based, I'm evidence-bound. I want to find out new ways to do things that are better than what we're doing now. And I think if you continually focus on evidence-based medicine, then that is going to stifle any type of innovation, which I think you've gone out of. I mean, I think you've kind of looked for other things outside of the box that most people are not looking at.
Yeah, no, for sure. I think that's just again, a beautiful journey that you took, and I thank you for sharing that kind of spiritual influence on that decision to obtain your functional medicine kind of certification. And definitely want to explore that more kind of offline and pick your brain on that more, because I mean, more and more that I practice traditional medicine, the more I'm leaning more towards functional medicine, just not knowing that that's what it was really called. So, personal stuff. So, I'm going to piggyback off a couple of things that you asked, but you and Amanda, you've been married, you said 10 years now.
Yeah, 10 and change. Yep.
Do, did you do a 10-year anniversary trip
So
anywhere?
we did not, just for reasons of like just life in general. But it was kind of like this thing where we didn't have like a good time that we could go, and there were a lot of things changing. Everything's changing in your life, you know what I mean? And so
Yeah.
nothing was stable, and so we were like, well, let's just figure out a different time to do it. We've developed really, really. I mean, we ended up doing one at our 11-year anniversary, or 10.5-year anniversary. So we've met some just tremendous people here in Grand Rapids, and all of our there were three of us that all had a 10-year reunion in the same year, and we decided that we would all go to Turks and Caicos for our 10-year anniversary, and we would take the kids because all of our kids get along, and they have a wonderful time. So we went down to a beaches resort down in Turks and Caicos for our 10-year reunion. We were there for a week, and it was fabulous.
Awesome. When did you guys do that?
That was in February of this year.
Okay. So
Yeah.
back to Amanda, what do you and her like to do together? Like, what are your favorite hobbies, pastimes, not kids included? Do you
Yeah.
guys do anything special together?
It's difficult because especially with kids. I mean, everything's consumed by kids. Our best, like you said with Karen, it's just like getting out and just being with her, and no phones, nothing. It's like just enjoying the person that you married. And I think that kids are interesting because they are the ultimate blessing, but they're a challenge too, because then it really challenges your relationship with your wife, because then the relationship that you had before them was far different than it is with them. And I don't think that, you look at physicians, they get divorced a lot, and they have, we have our own set of social issues that we have to deal with. But I think we never really engage in our marriages enough. And I think that we become married to our practice, and that's not what I wanted. And I think that's not what you want. And so I think that just the small things of, okay, we're going to have somebody watch the kids tonight. We're just going to go out to dinner, and we're going to chat about life. We don't do anything extravagant. We don't take many trips. Just the time that we get to spend together on date nights and stuff like that. And I think that that's something that we need to make more consistent. Is like maybe once a month. We have some friends in Oregon that once a month, it's a non-negotiable. They go out and they enjoy, and they invest in their relationship. And I think that those are the moments that I think really matter, and those are the things that we do. I think that from the trips, Turks and Caicos was wonderful, and I loved our honeymoon in Cancun. Those were all just very memorable trips for us.
Yeah. So how about the kids? What are some of your favorite things to do with your son and your daughter?
So they're completely different. Sam is my buddy. I love playing catch with him. He loves baseball. He loves hockey. He loves like literally any sport he loves doing. And so anything that he does, he has this high level of excitement about, and he just wants to do it right now. So the small things, going out, playing catch with him. That's what I always envisioned as being a father. And I think that that's what most fathers look at, is like, I'm going to play catch with my son. And I think that there's something, I think, deeply spiritual about that activity alone, of just going out and for some reason catching a ball is something so deep that you do with your child that you can't even put like words to it. You know what I mean? And so those things for me are just amazing. My daughter, she's she's equally as ecstatic, but in different things, very girly things. She likes to be like, she went to a martial arts thing yesterday with my in-laws, and she wore a bright sequence dress, and like you can't miss her. She's like all over the place. Like she's a walking billboard. She loves dance. She loves playing dolls, doing all that stuff. And when she says, "Daddy, will you come play with me?" That's, you drop everything and that's what you do. So those are the things that I mean, whatever they want to do, that's what, and that's part of being a father. It's not about me, it's about them.
Yeah, no, it's awesome. Last night, the two older boys were over at the neighbors playing wiffle ball, and our youngest, they were all older kids. So Luca, he'll play with them a lot of times, but he just wasn't feeling it last night, so he stayed back. Karen and I and Luca, we watched the Kentucky Derby, all 2 minutes of it. Um, but then he was just like, "I'm going to go out and play basketball." So went out, and there was a storm coming in. I was like, "Well, we got to pick up all these baseballs and all this stuff." And I was like, "You want to play catch?" So we literally played football in the backyard, just like we did in New York City in Central Park for a good 45 minutes or so. And it was
Yeah,
just like just him and I. And you're right. Like it seems so, I don't, meaningless isn't the word, but like trivial. But there is something
yeah.
spiritual about it. It's just like, especially when you see the progress, right? Like I remember
Mhm.
just a year ago or so throwing the ball and it bounced off his chest or this or that, like seeing his confidence build, seeing his skills build, and just that
Mhm.
true, genuine, just like enjoyment that he feels in my presence and mine in his. And it's just like
Yeah,
nothing else matters right now. No one else matters right now. It's just two people
yeah.
connecting.
There's something about playing catch that is a big deal, and, it's interesting because my, a good friend of mine, you know him. I mean, you met him at my wedding, Jason.
Hmm.
He was diagnosed with gastric cancer at 33, and, he's still alive today. But he was a big baseball player, and he developed this organization with another guy that had cancer at a young age that I think lives in Ohio. And their whole thing was play catch. And so his thing was he would have people come and he would film it and then he would post it on Instagram. But it was like he would play catch with every meaningful person in his life. And that was, I mean, I think there is something deeper to just playing catch. It's not a trivial act. It is something. I mean, you go back in history. I mean, that's what fathers and sons do. They play catch together. And I think that there's a deep bond that you develop with just that simple, trivial thing of just playing catch. There's something deeper to it.
Yeah. So you mentioned your in-laws and your parents. I know are big in your life. So are they all now in Grand Rapids?
They are. They moved. Yeah, they moved to
So
Grand
you
Rapids.
got everybody to move to Grand Rapids.
Yeah, we were the stable. I have a brother that lived in Denver, and now he lives in Kansas City. They're kind of wild cards with regard to where they want to live. They see an opportunity and they go, which that would be an amazing thing. I'm kind of tethered here for work and a lot of other things. I think we a lot of people are tethered to a specific location. It's easier, but they don't see that. And so my parents didn't feel comfortable moving close to them with the idea that they could move at any time.
Right.
My sister-in-law and brother-in-law live in New York City, and we only have one sibling each, so it was easier for them to make that decision. They live in New York City, and I think economically that's unfeasible for them to move to New York City. And so
Sure.
the default was, well, they want to be around their grandchildren. Grand Rapids was the most sensible place for them to both be.
All right, so yeah, we're at the seventh inning sawbone shoe stretch. So normally I have my guest do it first, but I'll go first. So these are the, as always, Jordan 6 lows. These are the Paris Saint Germains. Um, I'm a huge Jordan 1 fan, huge Jordan 3 and 4 fan. This is my only pair of Jordan 6s, but I'll tell you what, they're super comfy and just a kind of a cool colorway, gray, kind of a cream color, and then they've got the orange Jumpman. How about yourself? You had a cool pair that
So
you had there sitting.
I I am not a shoe guy, but one thing that I can tell you is that you've always been a fan of Jordan. I think the reason is different than most people. It's like you just look at his craft and look at how amazing he is. I think Tiger Woods is the same thing. You know, you look at just what he's done with golf. I'm also a big Michael Jordan fan, and I think that the
Yeah, it's
people that
beyond
are our
basketball to
age.
me.
Oh yes, correct. Yeah, 100%. I mean, this was a work ethic thing. Yeah, Tiger Woods is the same way. I mean, you look at him and what he did with golf wasn't just on the course. It was like everything that he did off the course, which
Yeah.
was important for what he did on the course. But people that are our age will, and then the younger generation will never understand how great Michael Jordan actually was. I mean, he was fantastic. Anyway, so I have my shoes here. I don't have them on right now, but I have the barefoot shoes. So I've become more of a fan of barefoot shoes, more from the functional medicine community than anything else. And being an orthopedic surgeon, I look at we have high levels of knee arthritis, and I started listening to a podcast about this guy that did footwear, and he went on a sabbatical, and he had a bunch of health issues, and he went on a sabbatical, and he started running. He was a big runner, and he started running barefoot on the sand, and a lot of his health issues just went away. He didn't change much other than, well, he reduced the stress in his life because he was on a sabbatical and everything else. But he was more interested in what was happening with his feet, and so he came back and he did a lot of kinesiology work, and he was starting to look at the biomechanics of how the foot works and kind of a theory behind why people develop arthritis at the knee more than they do at the hip. And he thinks that part of the contribution is that we get so concerned about protecting the arch of the foot and protecting the foot that the biomechanics don't work appropriately. And so, we see it in spine surgery where we get this adjacent level disease. So you fuse one level and then the level above it and below it start to see more stress than it's used to seeing. And then you develop, arthritic conditions in those because you're overworking those joints. So he thinks that at an early age, we put people in supportive shoes, and this kind of leads to a dysfunction of how the foot is supposed to work. And he doesn't think that the foot develops appropriately, and that leads the knee susceptible to more stress than it's supposed to see. And he has a lot of research out that supports this theory as well. And so I've talked to a lot of different people about shoe wear. It gives you more grounding and more connection to the ground. It allows the biomechanics and the intrinsic muscles of the foot to develop. And so that's kind of why I've adopted wearing barefoot shoes. I wear them when I work out. I wear them, when I'm walking around. So I think being barefoot and developing those muscles of the foot, that's kind of where I got into my shoe wear.
Interesting. Well, hopefully not too many of my patients were listening to that. So that no, I'm kidding.
Well, the thing is I talk to a lot of my patients about this. If you have arthritis already developed, these barefoot shoes it's not going to do
Yeah,
the trick.
and I'm totally kidding because I'm all
Yeah,
for
yeah,
you know
yeah,
preventing and making sure that we can be healthier as a whole. But
yeah, for sure.
so Blake, obviously it was awesome having you on, reconnecting again. Definitely want to do this a little bit more on the offline side as well. Um, I wish you, Amanda, your children, your parents, your in-laws the best. It's been a pleasure. As I mentioned earlier, just connecting with you. It's a deeper connection than I've genuinely have with most of my other people that I talk to on a regular basis, just because we can go deep pretty quickly. So I want to thank you for
Yeah.
that.
Well, the feeling is absolutely mutual. I don't know that I can explain in a way that your listeners will understand of how impactful you've been to my life, in a positive way. You are one of those people that, even though we haven't seen each other or talked to each other for a long period of time, it's like we just kind of left off where we left it almost 9 years ago.
Yeah.
You have a very special place in my heart. You are, I mean, the one of the most influential people in my life, and I thank you for everything that you've done for me.
Well, likewise. I mean, you continue to inspire me, to encourage me to um, think outside the box. I do that pretty naturally, but you inspire it to a different level. And especially with this whole functional medicine piece, it's just like almost like that aha moment type of thing. So thank you for sharing that story. Thank you for sharing your passions. And for all the guests out there, I encourage you, share this with your friends, like it, leave comments, leave suggestions. If you have any people that you think would be a great guest, please let us know. And, we'll be back soon. So have a great day. And as always, thank you very much.
Thanks for having me on. It was a pleasure.
Yep. Thank you, Blake.
Thanks, Ryan.